The evidence is creating that the risk factors of cardiovascular diseases observed in children are an ECV event predictor in the middle age. The question for GPS and other doctors is, what should be the next step? A world team of researchers from the International Cardiovascular Children's Cohorts Consortium reported this month at the New England Journal of Medicine that ECV risk factors, when measured in childhood, strongly predict the appearance of ECV events in medium age. The findings were obtained from a 40-year follow-up study of 38,589 children from the United States, Finland and Australia. The risk factors included those that are conventionally used in the detection of ECV risks for adults: blood pressure, serum lipids, body mass index, and factors that are repeatedly shown in prospective cohort studies in adulthood that are important predictors of the posterior ECV. However, similar evidence has not been available for these same risk factors when seen in children. The reason for this is that obtaining that evidence requires a sufficiently large and very long-lasting sample size, which covers the period from childhood to the age when ECV events begin to be common, the Middle Ages. The practical difficulties in assembling this study seemed insurmountable until 2002, when Australian researchers, who had embarked on a monitoring of children at Australian schools surveyed in 1985, suggested their counterparts in the United States and Finland that they could group the data of their cohorts and follow them to occur ECV events by medium. All cohorts had begun to register the participants in the 70s and 80 years and had measured the risk factors of ECV at least once in childhood at the ages of 3 to 19 years. The 5 risk factors in children that are associated with the risk of an adult ECV event, most of which were fatal or non-fatal strokes or stroke Y. All risk factors in children were significantly associated with a higher risk of adult ECV events, both fatal and non-fatal, with risk relationships for those whose values were above a clinically defined cut point, for example, high BMI or high cholesterol, which ranges between 3.39 and 2.13. The risk among those who had more than one risk factor, identified through a risk score, was considerably greater than a single risk factor. It was estimated that children whose combined risk scores were in the upper 5% of the distribution had a risk of a CVD even.